Hey there, healthcare heroes! Today I want to talk about something incredibly important, World Tuberculosis Day. Each year on March 24th we unite to end TB, one of the world's deadliest infectious diseases. But here's the thing, TB is preventable and curable, so let's dive into how we can educate, prevent, test and treat TB effectively. First things first, what is tuberculosis? TB is a bacterial infection primarily affecting the lungs, but it can also spread to other parts of the body. It spreads through the air when someone infected coughs, sneezes or even talks. There are two main types of TB to be aware of: active TB disease and inactive TB, also known as latent TB infection or LTBI. Active TB means the person has symptoms and can spread it to others. Inactive TB means the bacteria are dormant, no symptoms, but it can become active if untreated. Now, who's at risk? Certain groups have a higher risk of TB infection. This includes people with weakened immune systems, like those with HIV, diabetes or cancer. Healthcare workers, people in high-risk settings like hospitals, shelters and nursing homes, and individuals with close contact with TB patients are also at higher risk. Plus, people born in or traveling to TB endemic regions such as Asia, Africa and Latin America should be extra cautious. So how can we prevent TB? 1. Early detection and treatment is key. Get tested if you're at risk. Early detection prevents the active disease and its transmission. And remember, complete your TB treatment. Stopping early can lead to drug-resistant TB. 2. Protect yourself and others. If you have symptoms or are in a high-risk setting, wear a mask. Ensure good ventilation in crowded places to reduce TB bacteria in the air. And always cover your mouth when coughing or sneezing. 3. Strengthen your immune system. Eat a healthy diet rich in vitamins and proteins. Manage underlying conditions like HIV or diabetes. Exercise regularly to boost your immunity and lung health. 4. Vaccination. The BCG vaccine protects young children from severe TB forms, but immunity weakens over time. So, even if you had the vaccine, testing for TB is still crucial. Speaking of testing, know your TB status. According to the CDC, up to 13 million people in the US may have latent TB. There are two types of TB tests: the TB blood test, IgRA, and the TB skin test, TST. Talk to your healthcare provider to determine which test is best for you. Now on to treatment. If you test positive for latent TB, treatment can prevent it from becoming active. The CDC recommends short and effective 3 or 4 month rifamycin-based treatments when possible. Without treatment, 1 in 10 people with latent TB will develop active TB and spread it to others. So how can you help on World TB Day? Get tested if you're at risk. Spread awareness about TB prevention and treatment. Support TB programs that provide testing and treatment worldwide, and advocate for better TB care and research funding. Together we can end TB. Thanks for tuning in, healthcare heroes. Stay safe and keep fighting the good fight.